To all, today we'll deal with the topic mandible. So mandible is a U-shaped bone. It is also called as lower facial skeleton. It's the largest and strongest bone of the face. So now coming to the features of the mandible. Mandible is having a body. So this is the body of the mandible and two rami will be there. Okay, first we'll deal with the body. So body, it's a horseshoe shape. You can see it's a horseshoe shape and it's having two surfaces. This is the external surface and inside this will be the internal surface. And two borders will be there. This is the upper border and this is the lower border. Now coming to the external features. First thing is the faint line which you can see in this upper part of the midline. So this is the symphysis mentae. And just below the symphysis mentae you can elicit a triangular area in this lower part of midline. This is called as the mental protuberance. And either side of this mental protuberance you have mental tubercle. The small projections are mental tubercle. So this is the symphysis mentae. This triangular area is the mental protuberance and either side you have the mental tubercle. And this is the mental foramen with the mental nerves and vessels pass through it. This is a mental foramen. Now just below this teeth, just below the incisor teeth, this area you have a shallow depression which is known as the incisive fossa. So these are the two incisive fossa. And this is the continuation of anterior border of the ramus. This is the ramus anterior border. Continuation of this anterior border, this faint ridge which is called as the oblique line, which you can see on the either side. This is the oblique line and this is the incisive fossa. Now coming to the internal features. Okay, so internal features, you have a mylohyoid line that extends downwards and forward just below the third molar tooth. So this is the mylohyoid line. The above part of the line is called as the submandibular fossa and below part is called as the sublingual. If this is the mylohyoid line on either side, this below part is the sublingual fossa and above part will be your submandibular fossa. And here you can see irregular elevations on either side. This is the one irregular, this is the other. This irregular elevations which you can see is known as the genial tubercle. So internal features, you have to remember about the mylohyoid line, submandibular fossa, sublingual fossa and irregular elevations known as genial tubercles. Coming to the borders. So I already told we have upper border and lower border. Upper border is also called as the alveolar part. This is also called as alveolar part and here you can see 16 sockets will be there for the roots of the permanent teeth. Lower border which is also called as the, this is the lower border which is also called as the base of the mandible. Now coming to the ramus of the mandible. So ramus of the mandible is having a lateral surface, medial surface, upper border, lower border, anterior border and posterior border. So first is the medial surface. This is the medial surface. Here you can see a foramen which is known as mandibular foramen. Either side you can see two foramens which is known as mandibular foramen and this is the mental foramen. So mandibular foramen, inside is the mandibular canal. And just near to the mandibular canal, a tongue shaped projections you can see in this anterior margin. This is the mandibular canal, this is the anterior margin. A tongue shaped projection is seen which is known as linguala. And lower end of the foramen, this groove is called as the mandibular groove. Mylohyoid groove. So now coming to the borders, this is the upper border. Upper border is thin, okay, and it is having a notch. This is the notch you can see in the upper border which is known as mandibular notch. This is the mandibular notch. This here mesenteric nerve as well as vessels are crossing. So this is the mandibular notch. Now lower border, this is the lower border. They are the backward continuation of the base of the mandible. I already told this is the base of the mandible. So this is the continuation. Lower border is just the continuation of the base of mandible. and this is the anterior border, this is the posterior border. Anterior border, you can see it is continuous with the coronoid process. So this is the coronoid process of the mandible. And posterior border, they continues with the condylar process. So this is the coronoid process, this is the condylar process, and this is the mandibular notch. In the posterior border, it meets with the lower border to form the angle of the mandible. So this is the angle of the mandible. It meets with the lower border to form this posterior border, and lower border meets together to form the angle of the mandible. This is the angle of the mandible.